I still cannot fully imagine what your lives as students have been like these past 2 years. What I want you to hear, though, is my sincere and deep gratitude to you for your dedication and commitment to doing all you could to help mitigate the spread of COVID. Because of your efforts, we have been able to keep the campus open and we have our in-person graduation. So thank you. Like so many of you, I'm continuing to hold my breath on getting through COVID. Will we experience another surge, another variant? Will we return to indoor mask mandates at UAB? Well, the short answer is, of course, we don't know. But if we must shoulder new responsibilities and more work in developing new mitigation strategies, there's nowhere I'd rather be than right here at UAB in the School of Public Health. Students, staff, and faculty have not only shown themselves to be incredibly resilient, adaptive, and innovative when facing the pandemic, but you have made significant impacts in your work on such projects as the case investigation and contact tracing project with the Alabama Department of Public Health, already putting your classroom knowledge to real-world efforts to combat COVID. This applied learning will be of great benefit to you as your career evolves post-graduation. But this is not meant to be a lecture about the COVID pandemic. Instead, I want to get you to thinking about three things on the cusp of your graduation: goals, lifelong learning, and relationships. Whether he said it or not, Yankee catcher Yogi Berra is credited with saying, "If you don't know where you're going, any road will lead you there." Set goals for yourselves so that your road intentionally leads to somewhere and you will know when you arrive. But don't believe that you have to set lifelong goals that are immutable. Our time horizons and our ability to forecast are on a much smaller scale. Think 5 years, as my fellow dean at Emory, Jim Curran, said this week in my interview with him. That's what he thought when he was first appointed as dean in 1995. But every 5 years, he had a new set of goals. And now, after 27 years as dean, he is able to look back and see a series of goal achievements that have all built on each other. I'm reading a book on leadership and health equity by Dr. David Satcher, former Surgeon General and former director of the CDC, the Centers for Disease Control and Prevention. In it, he quotes Dr. Benjamin Mays, the president of Morehouse College, where Satcher was an undergraduate, talking about the importance of goals. Dr. Mays says, "It must be borne in mind that the tragedy of life doesn't lie in not reaching your goal. The tragedy lies in having no such goal to reach. It isn't a calamity to die with dreams unfulfilled, but it is a calamity not to dream. It is not a disaster to be unable to capture your ideal, but it is a disaster to have no ideal to capture. It is not a disgrace not to reach for the stars, but it is a disgrace not to have stars to reach for." He goes on to say, and I paraphrase, that failure is not the wrong. It is low aim that is the wrong. So set goals. Second, there's no better time than at graduation to commit to lifelong learning. Keep hungry for new knowledge. And if you are in research, keep hungry for creating that new knowledge. But let me caution you to be humble in the learning process. In a couple of weeks, I'll be headed for a week-long visit to the Aga Khan University in Karachi, Pakistan, to continue building collaborative opportunities for faculty and staff. Something that I will be taking with me is this framed sheet of paper on my desk with the title Humility. The sheet of paper comes from my 2 years at the Aga Khan as an international health fellow at the beginning of my career in public health 34 years ago. One of the challenges we were working on was an effort to lower maternal and infant mortality. We were providing a series of training workshops with the traditional birth attendants, the DI, who were skilled in the ways of childbirth despite having no formal education. In fact, most of the DI were not able to read or write in their native language. So we developed a pictorial key or flowchart for identifying and lowering risk of poor outcomes. So if the mother's condition looks like this, you do this procedure. And if that changes the situation to look like this, something else, then you do this other procedure, and so forth and so on. A pictorial flowchart for the major causes of infant and maternal mortality. And the DI would then put a check mark in the appropriate box on the flowchart and proceed accordingly. Wait a minute. Check mark? What's a check mark? You see, since these women could not write in their native language, they had no reason to ever hold a pencil, and thus never had an opportunity or reason to make a check mark. So our first afternoon training session was in taking a writing pad and going from die to die, practicing check marks. And I saved the sheet of paper from that writing pad. We thought we were so smart in developing the pictorial. Humility was what we needed more than smartness. So be humble in how you learn and share your knowledge in your lifelong commitment to learning. Finally, let me say a few words about relationships. This celebration is the first of what will be a series of commencements. Since we most often use that word in the context of graduation, it has a connotation of finishing, of ending something. But if you quickly Google commencement, you will find this from vocabulary.com. A commencement is the act of starting out or blazing a new trail. Anything that begins has a moment of commencement. That's why a graduation ceremony is called a commencement. A graduate is embarking on a new life, and the commencement ritual marks the official beginning of that life. So this is indeed a new start for all of you. And the question I have for you is, how will what you learned and experienced as a student matter in your new beginning? How will you take the content of your coursework and apply it in a new context that doesn't distinguish between second floor epidemiology and third floor biostatistics? A new place and new context where there are no clear demarcations between the behavior of individuals and the behavior of organizations in the environments of each. And with your unique experience because of COVID-19, how will you use this opportunity to innovate? I focus on this word how because ultimately the impact of what you do in your new beginning will depend on relationships. Without those relationships, your what and why will have no place to land. Public health is a communitarian venture, and the internal ethic of public health demands a focus on social justice and equity, which again, ultimately depends on relationships, how we treat and respond to each other. So you may not remember a word I have said up here, but what you will remember is something about the person who sat in class next to you to your right or left, or who was most recently chatting with you in the Hill Center or on Zoom, or something in the connections that you have made with faculty and staff. Carry these relationships with you into your new beginning and make a difference. Congratulations to all of you, to all of our graduates. Thank you and go Blazers. I would now like to introduce our alumni speaker, Bryn Manzella, superstar alum, who currently is at the Jefferson County Department of Health. It's true, Bryn. If you can succeed in your careers in the ways that Bryn has, you will, as the saying goes, do us proud. Bryn?
I want to thank you, graduates, family and friends, Dean Irwin, faculty and staff at the school for allowing me the privilege and the honor to share in the celebration of the 2020 UAB School of Public Health graduating class. What a journey you've been on, and you are embarking in the future. A journey that's been made possible by those of you who are with us today, either in person, virtually, or just in thought and spirit with us today. And I thank you all. Using a slogan from a few years back in public health, we are all public health. That really resonates with me because we truly are. And I consider each and every one of you to be my distinguished colleagues. Graduates, while each of your journeys has been as unique and as special as each of you, we do share the journey of having been a student and now a graduate of the UAB School of Public Health. In a sense, the UAB School of Public Health is our shared home. What thoughts and feelings came to your mind when you heard the word home? For me, it evokes thoughts and feelings of development, nurturing, ongoing support, expectation, acceptance, belonging, and certainly pride. My hope for each of you is that you will share these feelings today, and that as your tenure endures as an alum, feelings will only intensify for you. Well, not to take a leaf out of Dr. Irwin's presentation, but I just can't not mention the extraordinary time in which you are students. The COVID-19 pandemic journey certainly has put public health on the radar, and unfortunately, more recently, it's put a target on us as well, both at the community level, but also the state, national, and world level. In addition to you, though, successfully navigating your education in the COVID world, which certainly required you to be flexible and to have compromise. Maybe you didn't get to take the class you wanted to take in person, for example. You did it. And you have also probably experienced both the highs and the lows of being associated with public health over these last 2 years. For this, you can surely add resiliency to your skill portfolio. And don't forget, that's really important. People like resilient employees. From the field, though, of public health, for all of us here locally, across the state and the nation, I truly want to share my appreciation and their appreciation for your help and support during the pandemic, and make a request that you take the lessons we are learning now and we will evolve over the next few years from the pandemic to advocate for and strengthen the larger public health system now and in the future. 37 long years ago, so even longer than you, Dr. Irwin, I, like many of you today, was contemplating a postgraduate world. As a proud and newly minted MPH in a time when most of my fellow graduates were mid-career, wearing reading glasses and adding advanced degrees to their already very impressive resumes, I was a little anxious about leaving my home and stepping out into a career beyond the walls of Tidwell Hall, which was then the home of the School of Public Health. I wondered, would the workforce appreciate the knowledge and skills that I had gained? Heck, did anybody even know what MPH meant? I need not have worried. I was prepared, just as you are. The amazing faculty and staff of the UAB School of Public Health have prepared you, just as they have hundreds and hundreds of your fellow alums, with the knowledge and skills to take advantage of the challenge of the ever-evolving field of public health and the many disciplines that some of you will pursue outside of public health. Clearly, you have learned to think critically and to apply a data-informed approach to problem identification, developing and vetting potential solutions, implementing interventions, evaluating the outcomes of work, and continuously improving processes and outcomes. But perhaps more importantly, you've learned to see with your heart and your mind what lies beneath the surface of challenges, to find their root causes, and to embrace the history that, and often painful journeys that have created, sustained, and now must be fundamentally changed to address those root causes. It is with seeing with your heart and mind that sets you apart as a graduate of the UAB School of Public Health. How you choose to use these critical skills on your own unique journey can truly change the world. My home at the School of Public Health, very much like my home with my parents before, gently shoved me out of my comfort zone. I left a job working on a smoking cessation grant for pregnant women with the school to take a position within the UAB Division of Pulmonary and Critical Care Medicine by following the sage advice of then Director of Health Behavior, Dr. Richard Windsor, following my graduation. For pulmonary and critical care, I was initially tasked with developing and implementing an asthma self-management program, which was a novel concept at that time. Now, very, very normal thing to be doing. Surrounded by brilliant physicians, I'll tell you why in a minute, they recognized that I had the ability to capitalize on their clinical knowledge and experience to help patients help themselves achieve healthier outcomes. My learning as a student and experience with the smoking cessation grant provided the framework for this program's success. Not to say that I wasn't intimidated and unsure of myself at times, but when I needed advice, coaching, or just a sounding board, I just went home where I received just what I needed and was always made welcome. I've gone home many, many times over these last years, and you can too. Just reach out. One quite memorable time for me, at least, was in late 2013 when my team and I at the Jefferson County Department of Health borrowed a large number of faculty members from the school to implement the local public health assessment for mobilizing for action through planning and partnerships, or MAP. I thought so. I thought a few of you might recall that process. And if you don't know what that is, just ask your graduate. This assessment was conducted over a very long and exhausting 8-hour day, which involved leading groups, intensive active listening, and detailed note-taking. Maybe not the typical day for a school of public health professor, but more of that of a UAB School of Public Health student. The help was invaluable and resulted in a comprehensive health assessment, which then informed a 5-year community health improvement plan for Jefferson County that I'm going to have to brag a little bit on my own team that received kudos and recognition from the Public Health Advisory Board, or FAB, when we were certified as a FAB certified health department. But far more importantly than that, new partnerships and friendships between the School of Public Health and community organizations were formed that day. These associations and collaborations continue to generate collaboration and support in an environment of mutual support. When I say your school is here for you down the road, you can count on it. As wonderful for me as the ongoing development, nurturing, and support from the school has been, being able to give back to my beloved school has perhaps been even more meaningful for me. I am forever grateful for the education I received and continue to receive through collaborations and continuing education with the school, which has opened career doors for me and solved many challenges. And I am grateful for the many enduring friendships with faculty, with staff, and with students that have helped me become a better public health practitioner and a human being. Over the years, I've been able to give back a little bit by providing lectures for some classes. Maybe you had the opportunity. I don't know, if you're a bachelor, undergraduate school, you might have. Field experiences and internships for students, and collaborations on research activities and publishing with the school. So there are many ways you can engage with your school after graduation. Just find the one that fits you. In 2017, I was honored to be asked to serve on the inaugural UAB School of Public Health Alumni Advisory Board, which provided some new avenues for supporting the school and its students. This innovative board is a great place to get engaged with your school after graduation. Each year, a few of our members roll off. So Sarah Hendren, hey Sarah, our dynamic alumni coordinator, is looking for new talent. And why shouldn't that be you, graduates of 2022? One of the many activities of the board is mock interviews for students, and all alumni are invited to participate. Not only do these interviews help prepare students for professional interviews, but they're an easy way to meaningfully give back, and it doesn't cost more than a few hours of your time. I hope you will take the opportunity to meet with Sarah tonight and explore the ways you can continue to serve your school. From time to time, I've also had the pleasure of supporting the school financially. Honestly, this really wasn't an option when I was first out of graduate school. But over the years, my husband Randy and I have been able to lend some support to causes we are passionate about, such as scholarships for students who are the first in their families to be pursuing a college education, honoring the faculty who molded me into the person I am today, and helping ensure that the school's building and technology are ready to best serve the students of today and tomorrow. When I'm in Riles 407, I bet you've all been in there too, a few times, the Herman Lehman classroom, I just feel this tremendous sense of appreciation for that amazing professor and mentor, and joy in knowing that the room's technology is helping to educate future public health practitioners. Graduates, as you reflect on this remarkable milestone in your own journey, please take a moment to thank those who have helped you in it. Perhaps these supporters include your parents, spouses and partners, other family, friends, co-workers, school faculty and staff. As proud as we all are of you, and as proud as you should be of yourself, none of us is on our journey alone. As I was thinking about this speech, the title of a famous book by author Thomas Wolfe came from my hometown of Asheville, North Carolina, entitled "You Can't Go Home Again," kept coming into my mind. Well, with due respect to Mr. Wolfe, I disagree. You can go home again to the School of Public Health. And when you do, and I hope you do and you do often, you will be welcomed, respected, nurtured, supported, and valued. Class of 2022, we are so proud of your accomplishments. And I personally can't wait to collaborate with you and to celebrate your future successes and the impact you're going to make on this world. UAB School of Public Health Class of 2020, would you please rise and remain standing for just a moment as we applaud you? I am a little overwhelmed right this moment. Back in 1985, we didn't have a service like this for graduation, and I didn't even walk. So today, you're letting me relive that experience for myself. I am so proud of you all. And I hope I can hang out long enough in public health to see all the great things that you all are going to do. Congratulations, UAB School Public Health Class of 2022. We will see you at home soon.
Okay, we would now like to recognize the winners of our 5 Outstanding Student Awards. Please come to the stage when I call your name. Let me first of all also say that I consider all of you graduating students to be outstanding winners in so many ways and celebrate you as Bryn just said. For our outstanding undergraduate student, Vani Mittal. We'll be doing pictures afterwards with the award winners. Our outstanding Master of Public Health student, Rose Albert. Our outstanding Master of Science in Public Health student, Haritha Jalapu. Okay. I don't think Haritha made it today. We will make sure that she gets this. our outstanding Doctor of Public Health student, Brittany Shelton. And our outstanding Doctor of Philosophy student, Juliana Bailey. Okay, I don't think Juliana made it either, so we will make sure that we get these to her. I will pass the baton now to Dr. Eric Ford, who is our Upsilon chapter president of Delta Omega, the Public Health Honorary Society. Dr. Ford.
Hello, I'm Eric Ford. Welcome. We're so delighted to have you with us again in person and be able to hold these ceremonies with your family in attendance. Delta Omega is the Honor Society for Public Health. It was established in 1924 at the Johns Hopkins University School of Public Health and Industrial Hygiene to recognize outstanding achievement in the new field. As such, members are selected for their contributions to and commitment for high standards of academic and professional competence and service. Membership in the Delta Omega Society reflects the dedication of an individual to increasing the quality of the field, as well as to the protection and advancement of the health of all people. This is an occasion for inviting new members into the society who share the same commitment and goals and have demonstrated so. We welcome them, and this opportunity is to recognize their achievements to earn this distinction. It's an honor for us to have you join the society. As a student, alumna, faculty, or honorary member, you embody the mission and vision of Delta Omega. Your qualifications have been reviewed and acted upon favorably by the leadership of this chapter. And as somebody who read all of these, it is truly remarkable the great many things you all have achieved already. We hope membership in the society is an honor for you as well. Membership in the Delta Omega Society has a special meaning in that you are dedicating yourself to continued excellence in the field of public health. As such, you ascribe to a high standard of performance in all that you do. If the new members would please come to the stage and face the audience, we will have the induction. We will now ask you to take the oath to join Delta Omega. Please state, "I will," after every statement. I aspire to demonstrate excellence in practice in the field of public health. I will. I aspire to demonstrate excellence in research in the field of public health. I aspire to demonstrate excellence in education in the field of public health. I aspire to demonstrate excellence in academic achievement in the field of public health. Congratulations on your induction into the Delta Omega Society. Our first inductee is Rose Albert from Environmental Health Sciences. Please stay. We're going to get a picture right afterwards if you don't. We're taking them as we speak. David A. Drew Crenshaw, an undergraduate. Samantha Fry from Health Policy and Organization. Anushri Gadde from General Public Health, an undergraduate as well. Radhika Gangaraju from Epidemiology. Eleanor Claire Lee from Epidemiology. Lori Malone from Population Health. Bonnie Mittal, another undergraduate. Emma K. Sellers. And Brittany Shelton from Health Policy and Organization. Thank you very much. At this time, I'd like to go ahead and turn the stage over to our development officer, Ebony Harris, and the Director of Development, Sarah Henderson. Thank you.
Good afternoon. I am Ebony Harris, the Director of Development for the School of Public Health. Students, on behalf of the development and the alumni team, there is only one thing I have to say, and that's congratulations. Congratulations on this outstanding accomplishment. You should be extremely proud of yourselves. I know that we are. And as Bryn so eloquently said, oftentimes our students don't get here alone. It takes a village, as the old saying goes. So I just want to take one quick moment to honor all of the parents, partners, friends, loved ones, anyone who contributed to your success in the room. So if you are one of those groups, just give a wave or stand up for a moment. So students, as you prepare to embark on this new journey, we want to welcome you to the alumni family. But make sure you don't stray too far away. We love to have you back. And in order to share a few words about how you can stay connected, I wanted to introduce Sarah Hendren, our Alumni Affairs Specialist, up.
Hi, everyone. I'm Sarah Hendren, Alumni Affairs Specialist for the School of Public Health. Though you may grow tired of hearing it, you've probably heard it a few times now. Please know how truly proud we are of each of you, our newest alums. The next several days will likely go by in a blur, but when the dust settles, we do hope that you'll remember that the support for you continues here at the School of Public Health. If you haven't already, I know I got to meet a few of you briefly and even in the last year, connected with you here and there. But if you haven't already, come and find me before you leave today. I'd love to share with you how to sign up for things like our alumni newsletter and get on our LinkedIn page. But also want to be able to share with you some of the resources and opportunities, events, things like that we have to offer now that you are part of our alumni family. I also hope that whenever you're in the area, some of you may continue to be in the Birmingham area, some of you may be moving away or have other adventures, but always drop us a line, let us know when you're in town. That's the fun part of our job. But again, as our newest School of Public Health alumni, you're always welcome here. Congratulations.
Hello, everyone. I'm Dr. Ella Austin. I'm the Associate Dean for Academic Affairs, and I will be wrapping up our event today. I do hope that everyone who is here in person will join us in the foyer outside for refreshments after we are finished. And for those students who are joining us online, I hope that you will be able to stay on for a few moments so that I can come and say hello to all of you. I second and third everyone's comments with regard to congratulations to all of our students. But I also want to say from a very personal place, as one of your teachers here at the School of Public Health, thank you for the last 2 years. I can't imagine what it has been like to be a student during the pandemic, as everyone has said. And I know, speaking personally and on behalf of all of the other faculty here at the School of Public Health, seeing all of you and the work that you were doing, the passion that you brought to your coursework and to your research and to your practice in the community, the grace that you shared with other students and with faculty as things changed minute by minute, all of the work that you did. Yes. All of that work, watching all of you work so hard to join the profession of public health and to go out and follow your passion and serve our communities. I can say as a teacher, though the last 2 years were hard, watching all of you made it all worthwhile. So congratulations and thank you. Thank you all for all that you have given the school over the past 2 years of the pandemic and however long for other students who have been here pre-pandemic, for all that you do for the school. And we are so excited to see what's next for all of you. Thank you for being here tonight and congratulations on your graduation.